I welcome you to the Healthy Heart, Healthy Life Pune session 14. I am Dr. Neelkan Karandikar, Chief Cardiologist at the Heart Clinic, Mukundnagar Alpha Diagnostics and Raghav Diagnostic Center, and Interventional Cardiologist at the Ruby Hall Clinic, Sahyadri and Dinanath Hospitals. I'm also Honorary Professor Emeritus in Cardiology and the first gold medalist of Bombay, now Mumbai University, in the DM cardiology examination. Today we are going to talk about the heart attack, recognition, reaction, and how to rescue a person who has developed a heart attack. Heart attack, recognize, react, and rescue is today's very important topic. No beauty shines brighter than a healthy heart, and therefore, when the heart cries for help, you have to rush immediately, you have to attend to it immediately and see that it remains and continues to be healthy. In order to help someone who is having a heart attack, you must first recognize the warning signs. We have discussed this earlier. Here is the man holding his chest. He is obviously in distress, and this tightness of or pain in the chest indicates that he probably has a blocked coronary artery in his heart, and the supply of some part of the heart, the blood supply and the oxygen supply of some part of the heart is blocked. The common heart attack symptoms are continuous pain in the chest, generally lasting for more than 15 or 20 minutes, or even in the jaw, shoulder, back, arms, and in the stomach area. Many times there is cold sweat and pale skin and shortness of breath, with also a feeling of weakness and fatigue. If you think someone is having a heart attack, or even if you think that have developed heart attack, call emergency services immediately. In the meantime, there are certain tips you can follow until the help arrives. Help the person sit down and try to keep calm. Reassure the person that help is coming and nothing will be wrong. Ask if they have taken any medication for chest pain. Many heart patients are on sublingual nitroglycerin tablets, and in case they are taking these tablets or they have these tablets, give one tablet under the tongue of that person. If the person is not allergic to aspirin, make them chew and swallow one tablet of it. Generally, this should be a plain aspirin and not an enteric coated aspirin, because enteric coated aspirin takes longer time to dissolve and become active, whereas the soluble aspirin starts acting fast, give 150 or 325 milligram dose. The tablets are of this same dose in most of the times, and then later you also get 75 milligram tablets, but 325 or 150 milligrams is what you need of soluble aspirin. Loosen their clothing if it is tight. So, if the person is conscious and you're suspecting a heart attack, then in summary, what you need to do, help the person to sit down and relax, ask the person to loosen any tight clothing, ask if they are taking any medication for chest pain, e.g. prescribed nitroglycerin, and give it to them under the tongue. This nitroglycerin should always be given when a person is sitting or lying down, never in a standing position, because the blood pressure can drop slightly with this tablet and a person can feel giddy. If the medication is available, help them take it. We have already discussed about aspirin, which is very important. Stay with the person and monitor the condition until the help arrives. I want to discuss how the heart is a different kind of organ in our body. Let me give you the example of red blood cells in our blood called RBCs. These RBCs live for about 120 days. Every day, about 200 million RBCs are destroyed, but the same number get manufactured and the total number in our blood remains constant. But that is not the condition in our heart. When an artery gets blocked and the cells in the supply area start dying, once these cells die, there is no regeneration. You don't get new heart cells getting formed immediately or at any stage. So this is something very important to remember. We have already seen this picture earlier. When an artery gets blocked, the heart muscle cells start dying very fast. And if you want to salvage these muscle cells, if you do that immediately, if the person is near a hospital, the artery gets opened by whatever means, angioplasty, or there are certain thrombolytic drugs which dissolve the clot, then if the dissolution of the clot blockage is done immediately, almost 100% can be revived. If it is done within 1 hour, almost 80% can be revived. But then as the heart muscle cells start dying fast, by around 4 hours, maximum damage has already been done. By about 6 hours, most of the damage has been done. We therefore talked about the golden hour for a heart attack, which refers to the critical first 60 minutes after symptoms begin, during which prompt medical intervention is crucial to save heart muscle, prevent permanent damage. This significantly improves survival and recovery as the heart muscle starts dying quickly without blood flow and you have to salvage the heart. During the first 4 hours of a heart attack, rapid damage occurs as the heart muscle dies from lack of oxygen. Significant irreversible damage, potentially starting after 90 minutes, and nearly complete tissue death is there by 6 hours. And heart muscle cells are not like red blood cells in the blood. They don't get regenerated. Once gone, always gone. Look at this video. That lion, that tiger is a heart attack, and the deer running is the poor patient, and the man running is you. You have rescued the patient by taking the patient of suspected of having heart attack soon, immediately to a capable hospital. So thank you very much. We have discussed today in short what are the symptoms of a heart attack and what you should do immediately. What we have discussed today is what you will do in a conscious patient, in a patient who is getting chest pain, sweating, etc. Next time, we will discuss what you do with an unconscious patient who have developed what is called as a cardiac arrest. That is a very serious condition. We'll discuss about that next time. Today, this session was in English. Next Thursday, it will be in Marathi, and the Thursday after that, it is in Hindi. If you ask me why these three languages, my intention is that most people should be able to see this video in the language of their choice, or maybe somebody wants to see in two different languages, they can do so also. And thank you very much for watching this video. I'm sure you must have subscribed to my channel. If not, please do subscribe. Give me a thumbs up. That will encourage me a lot in bringing newer and newer information to you, and also tell your colleagues, your friends, and your family members about my channel. Thank you very much. See you next time.